foster a relationship with a partner who is very supportive or who is supportive to you, where you can get emotional connection that can alleviate the concerns about your physical attributes. You guys, welcome again. The channel is Nazvin. Kindly, if you have not subscribed, I want to encourage you to subscribe. The channel, my name is Vincent. This is where we get to talk matters medical in a simple language which everyone can understand. And that's why we always encourage you to like the video, because by liking the video you get YouTube to recommend us to a larger population. And sensitive matters, as what we're going to discuss today, can reach a larger population. Guys, welcome, sit back and enjoy. So we're going to talk about the 12 things you should never do to your penis. The 12 things you should never do with your penis. Number one, I want to say, sure, here are the 12 things you should avoid doing with your penis to maintain its good health and also avoid or prevent potential harm. Number one, using of household items such as sex toys. Avoid using objects not designed for sexual use, as they may cause injury or infection. Number two is about skipping protection. Always use protection or condoms during sexual intercourse to prevent the sexual transmitted infections and also unintended pregnancies. That's very key. Overall tight constrictions. Always avoid using tight rings, cock rings, or devices that restrict blood flow excessively, as they can lead to injury or tissue damage. Number four, ignoring hygiene is also something which you should never do. Maintain good genital hair hygiene to prevent infections and also unpleasant odors. So also number five is about avoid rough handling. Be gentle when handling your penis to avoid causing pain, irritation, and injury. Number six is about ignoring pain or discomfort. So if you experience any pain, discomfort, or unusual symptoms such as discharge, is also very key that you go and seek the medical attention as early as possible. Number seven is about sharing the sex toys. If you're using sex toys, avoid sharing them without proper cleaning or protection, so that this may spread infections. Number eight is about using harsh chemicals. Avoid using harsh soaps, detergents, or cleaning agents on your genitals, as they disrupt the natural pH and also balance, and they can cause irritations. Number nine is about ignoring changes. Monitor your penis for any changes in appearance, sensation, or function, and consult your healthcare provider as much as possible. If you notice anything unusual, report to your healthcare provider. Number 10, avoid using tobacco or drugs, because by avoiding smoking or using the drugs can affect blood flow and also sexual function. So avoid smoking or using hard drugs. Ignoring erectile issues is also another factor. Number 11, where if you experience erectile dysfunction and also or sexual problems, kindly, if you have not watched our video on sexual dysfunction, it is in our channel, Nazvin. You can always check on it so that you get details on what sexual dysfunction is and how it is managed. So when you ignore erectile issues, so like sexual dysfunction or sexual problems, and you don't take medical advice, so you can get into a lot of problems. And also engaging in risk sexual practices. Avoid and protect your sex with multiple partners or risk sexual behaviors which can increase your risk of sexually transmitted infections or injuries. So by following the guidelines and maintaining regular checkups and with the healthcare provider can help you to ensure that you get health and also well-being of your penis and overall well-being. When it comes to managing the health and well-being of your penis, there's a key aspect which you should look at. This is very key, how you should manage your penile health. Number one is about hygiene. Maintain good genital hygiene by washing your penis with mild soap and water daily. That's men should ensure that, and also ladies help men do this. Avoid harsh chemicals or strong soaps, which can disrupt the balance, the natural balance of the skin. Number 2, safe sex practices. Practice safe sex using the condoms to protect against sexual transmitted infections. Also discuss STS testing with your partners and get tested regularly. So number 3 is about regular medical checkups. Schedule your regular medical checkups with the healthcare provider, especially if you notice any changes in your penis, such as lumps, pain, or discharge, because early detection of the issues can be very crucial in the treatment of the same. Another aspect which is very key is about healthy lifestyle as a way of managing your penile health. Adopt healthy lifestyle. This includes regular physical activity, balanced diet or nutrition, adequate sleep, quality sleep of 7 to 9 hours, avoid excessive alcohol and also tobacco use. Healthy lifestyle supports overall functioning of your sexual health. Number 5 is about addressing erectile function. So if you experience erectile dysfunction or other sexual concern, discuss openly with your healthcare provider. Also, treatment options may include lifestyle changes, medications, or counseling. Avoid harmful practices. When you talk about harmful practices, avoid risk behaviors such as using household items, such as the sex toys, use of excessive force during masturbation, or engaging in activities that could cause injury to your genitals. Number 7 is about self-examination. This is very key, man. Perform regular self-examination of your penis to monitor for any changes in appearance, sensation, or function, and report any concerns to your healthcare provider to get as much help as possible. Also, emotional well-being is very key. Pay attention to your mental health, men. Last month, June, was Men Mental Health Month. So emotional well-being is very key, where you manage your stress, anxiety, and depression, which can affect the sexual function and overall health of you. So seek support if needed from the therapist or the counselor as possible. Number 9 is about educational resources. Stay informed about your sexual health and wellness by accessing reliable education resources and discussing the same with the healthcare provider to help you get that knowledge which is needed, so that if you have any questions or concerns, the healthcare provider can get to address them as appropriate when you have those educational resources. Relationship communication, very key. That's number 10. Even if in a relationship, maintain open communication with your partner about your sexual health, preferences, and also concerns. Building supportive and understanding relationship environment can enhance overall sexual satisfaction. So by managing your penile health proactively through measures, you can promote longevity, functionality, and also overall well-being. So regular checkups, open communication, and with the healthcare providers are essential to address any concerns early and also ensuring optimal penile health. Sometimes we have complications related to penis health. Several factors can contribute to these issues that may affect the physical, emotional, and also sexual well-being. Some of those potential complications, we have physical ones, we have emotional ones, we have social and behavioral complications. But I want to start with the physical complications. Number 1 is the injury. Vigorous or rough handling of your penis, especially during masturbation or sexual activity, can lead to injuries such as penile fractures, bruising, or tears or tears in the penile tissue. Number 2 is about infections, where poor hygiene and unprotected sexual intercourse or using contaminated sexual toys can lead to infections such as balanitis, that's the inflammation of the glands, or sexually transmitted infections. Also, we have what you call perineal disease. This involves development of scar or tissue inside the penis, causing the curvature or bending of the penis during the erections, which can lead to pain or difficulty in sexual intercourse. Number 4 is about dysfunction, erectile dysfunction, what we call ED. Various factors including physical conditions such as diabetes, cardiovascular diseases such as hypertension, psychological factors such as stress and anxiety, and lifestyle choices like smoking, excessive alcohol consumption can contribute to erectile dysfunction. We have number 5 also, what we call reapism. These are prolonged or painful erection that can last for several hours. This is a very bad emergency. It requires immediate medical interventions to prevent the tissue damage and also permanent erectile dysfunction. On the emotional psychological complications, we have body image issues where we have concerns about penis size, shape or appearance. Can lead to anxiety, depression or body dysmorphic disorder, what we call BDD. So number 2 is about performance anxiety also. Fear of not performing well or meeting the perceived expectations can lead to other problems. Further exacerbate the erectile dysfunction or sexual dissatisfaction. Also, relationship issues can crop up. Complications related to penis health, such as erectile dysfunction or sexual pain, can strain intimate relationships and lead to communication difficulties or emotional distance. Social and behavioral changes. We have risk-taking behaviors like engaging in unprotected sex or sexual behaviors can increase the risk of the STS or unintended pregnancies. Self-harm is also another one where we have, in extreme cases, individuals may engage in harmful practices such as self-mutilation or unsafe methods, or which can alter the penis size or appearance, which can lead to severe physical and also psychological consequences. Preventive measures and management is also another one. To prevent these complications to penis health, it's very key that you practice good hygiene, including regular washing with mild soap like I mentioned and water, use of condoms consistently during the sexual intercourse to reduce the risk of STIs, seek prompt medical attention of any injuries, infections or concerned symptoms, maintain health lifestyle like regular exercise, balanced diet, and also adequate sleep. Stress management is very key. Communicate openly with your healthcare provider with any concern relating to your penile health or sexual function. Avoid risk sexual behaviors and unsafe practices that can lead to physical harm or emotional distress. By taking these proactive things, you get to help yourself very well, so that you get to manage your sexual health in a good way. So medical checkups, regular medical checkups is very key also. Schedule your regular checkups with the healthcare provider to monitor your penile health, discuss any concerns, and also receive appropriate screening. Early interventions is very key, guys. Seek prompt medical attention for any concerns regarding your penile health, so that if you have a discharge, pain, swelling, lumps, this is very key that you should be. This could include other health issues that can require treatment. By following these preventive measures and maintaining overall health and well-being, individuals can significantly reduce issues with their sexual health. So hygiene, safe sexual practices, healthy lifestyle, stress management, communication with your partner, honestly connect with your partner, regular checkups are the key preventive measures in taking care of your penis. So guys, that's the information about the penis, and I want to welcome you to the channel. My name is Vincent. This is where we get to discuss matters medical, matters sensitive as the penis here today. By liking the video, you get YouTube to recommend us to a larger population. Kindly guys, many of us are watching without subscribing. I want to encourage you to subscribe, so that we have a big family in this Naswin, so that many people can get the sensitive information such as this in a simple language without using any medical jargon here. That's why anyone is welcome to the channel. This is where we get our basic medical education, and also to help us as we live in this world. Guys, welcome, because I want you to have that healthy body and also a healthy lifestyle, and I want to welcome you to our next video. Peace, guys, and I will love you very much. So guys, about avoiding, also avoiding unproven method is very key. Consider what your healthcare provider gives you about the same. Healthy relationships is another one where you need a supportive partner. Foster a relationship with a partner who is very supportive or who is supportive to you, where you can get emotional connection that can alleviate the concerns about their physical attributes. Avoid also comparison, especially for the partners, especially the ladies who want to compare you to maybe another partner. It's very key that you don't compare your partner with the other one because of other factors also. Also, regular medical checkups is very key, where you get to detect and also address an underlying health issues which can affect the sexual health at the end of the day. Stress management is also another one. When we talk about stress management, we're talking about relaxation techniques. We talk about meditation, yoga, and also mindfulness and deep breathing exercises. Also, regular physical activity can really help in this. So when we talk about also vaccination and screenings, stay up to date with your vaccinations and also screening to prevent sexual transmission diseases, that's STIs, and overall health of your body. So also peer support is very key, where you join support groups, which participate in support groups or online forums, where you can get to share the experiences and get advice with the similar concerns. Also, positive role models is another aspect, where you get you surround yourself with positive influences, with role models who can promote your health, body image, and also self-acceptance. So, to prevent these complications related to penis size, it involves holistic approach, guys, so that which include education, lifestyle changes or choices, psychological support, effective communication, and also avoiding unproven methods. So focusing on overall health and also well-being, if your concerns also persist, it's very key, like I always tell you, to seek your healthcare provider to guide you accordingly. So things like education awareness, overall health, mental health and emotional health, open communication, sexual health education, avoiding unproven methods, healthy relationships, regular medical checkups, stress management, peer support are very key in managing and preventing those complications. Guys, welcome. The channel is Nazbin. My name is Vincent. Kindly, if you have not subscribed, I want to encourage you to subscribe, because by subscribing, by liking the video, you get YouTube to recommend us, so that such vital information and sensitive information as this can reach a larger population. Guys, welcome, and also welcome to our next video. Thank you, guys. Peace, and we love you very much.